Hello, 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 and welcome to another episode of Wellness Wednesday with Dr. Latoya Wells. I am Dr. Latoya Wells, Doctor of Nursing Practice, family nurse practitioner, and owner of Wells Legacy Health and Wellness. Welcoming you to another episode of Wellness Wednesday. I know I wasn't here last week, but it was for a good reason. So I'm glad to be back with you all tonight. And before I get into tonight's topic, I don't want to brush over that it is still Breast Cancer Awareness Month. And we're still celebrating all things survivors, warriors. We're celebrating the strides that have been made when it comes to research and healing and all the things breast cancer. And I do want to take just a moment to make space for those who are still battling, those who are survivors, those who are in the thick of it, and those who have either lost their lives, lost the family members to breast cancer. I hold space for you tonight, and I'm sending you a hug. We can all use a hug. I have a friend right now who is in the thick of breast cancer treatment, and I'm sending you a hug if you're watching this. Then also don't want to skip over the individuals in the country of Jamaica which was devastated by the hurricane, and Haiti and Cuba and all the other areas that were impacted by this most recent hurricane. We're definitely praying for them. I'm seeing the different efforts, fundraising, and giving back to those communities. And so, if you have an opportunity to give, make sure that it is a legitimate effort. And just everyone needs someone in this day and age, and we can all just use some kindness. And with all the thing that's going on in the world, I'm sending you all hugs. I'm sending you all hugs. I want to welcome you back to Wellness Wednesday. I'm excited about tonight's topic, as I am with all of our topics, because as I'm preparing for the lives, I'm doing a lot of research. I'm doing a lot of things to just kind of get ready for our live tonight. But this is one that I feel like is so important because it's something that we all do. We all experience this. And I don't know about you, but I don't think about breathing. I just, I don't. I automatically think I'm just going to do it, right? And I don't think many of us, unless you have some type of chronic condition that deals with the lungs, then we don't think about it unless we're having some issues. And tonight we're going to be talking about something that impacts us all. And we do it every single day, and we breathe. Our lungs are our life force, yet we often, as I mentioned, we don't think about it until we're sick. And for those who have chronic lung conditions such as asthma, COPD, and maybe some allergies, emphysema, some other things, scleroderma, that may impact their major organs, such as the lungs. Those individuals, that's all they think about each and every day, day in and day out, is their breathing and their ability to breathe. And so this week is National Respiratory Care Month, or Care Week. And it's important also because it's the start of flu season. And so tonight, we're going to talk about protecting our lungs, preventing illnesses, and learning simple habits that can keep breathing easy this fall, right? Can help us to remain healthy, to keep our lungs healthy and strong this fall. I just want to throw this out there, this caveat: COVID is still around. COVID has not gone anywhere. The flu A and B are on the rise. And so we have to do all that we can to make sure that we are staying healthy and that we're taking care of ourselves and our families. And you can be healthy and have the flu or have COVID, and it doesn't impact you. However, if you come in contact with someone who is immunocompromised or who has a comorbid condition, then they may have some issues. So let's just do the neighborly thing and take care of ourselves, because in taking care of ourselves, we're taking care of others. I'm going to get off my soapbox. But I want to dive into this, and I have a question for you. Have you gotten your flu shot yet? For those of you who've gotten your flu shot, if you're watching live or if you're watching this on the replay, say replay and drop a high five or the little needle in the comment if you've gotten your flu shot. I have not gotten my flu shot yet. I typically get it every year, and I will be scheduling that soon. I can tell you, and I'm just going to put this out there: if there's anything that I say during my lives or on any of my recordings or broadcasts that does not resonate with you, it's okay to keep moving. It's okay that everything that I say you may not agree with, and everything that I say may not be for you. My grandmother used to say, you chew me to spit out the bone. So if it doesn't apply to you, if it is not something that resonates with you, then you can just keep moving. I get inboxes about certain things. I don't debate and I won't debate with people. And so when it comes to your vaccination status, that's a personal decision for you and your family. And so if you're someone who does not believe in or agree with vaccination, no love lost. Keep it moving. You don't have to take what I say. You can make that decision for yourself. I'm going to get off that soapbox because I don't want to spiral down into that. But just know that my goal and my purpose here is to make sure that I'm providing information that's helpful to you, information that's helping you to advocate for yourself, information that you can share with your family and friends and people that you know who may benefit from this information, right? And I am a healthcare provider, but it doesn't mean that I know it all. And I can't respond to inboxes about health questions, and I can give generalities, right? But I can't treat you based off of symptoms and things that are sent via my inbox. So I'll just say that. But if you've gotten your flu shot, I want you to drop the little shot emoji in, or the needle emoji in the chat. Either you're watching it live or you're watching it on the replay. So why does our respiratory health matter? If we can't breathe, it impacts every part of our life. And you all know I love statistics, so we're going to be talking about some statistics, and I have my notes so I can stay on topic. Flu causes upwards of or more than 31 plus million illnesses in the United States each year, and about 12,000 deaths each year in the United States. That's a large number. 31 million plus, that's a lot. And so if it takes washing our hands, if it takes staying home if we're sick to keep these numbers from increasing, then let's do our due diligence to make sure that we're taking care of ourselves. And again, in taking care of ourselves, we're taking care of others. COPD, which is a chronic obstructive pulmonary disease, it is the fourth leading cause of death in the United States. And asthma affects 25 million Americans. That's 1 in 13 people. I can count on my hands 4 to 5 times over how many people I know personally who have asthma or who have dealt with asthmatic issues at some point in their life. And just one note that I want to leave you is that our lungs don't just help us to breathe. They help us move, they help us to laugh, they help us to sing, they help us to live. And when we think about that whole circulatory pulmonary, or CPR, right? Cardiopulmonary system, they work in tandem with each other. And so if one's not working properly, it's going to impact the other. And our lungs is so important. And while lung disease is common, there are so many things that we can do to protect our breathing and our health overall when it comes to our respiratory system. And it starts with knowing the symptoms. It starts with knowing what your medical history is, if you have a family history of certain things, the implications of smoking and vaping, and all the things that can impact our lungs. Even environmental or work-related illnesses or exposure can cause issues with the lungs. And so we're going to talk about a few of those things tonight. But one thing I want to talk about is the flu shot and why it's so important. One, it protects you from severe illness and hospitalization and even death. We just read the numbers. 12,000 people die in the United States annually each year from the flu. 12,000. And that's children, teenagers, adults, elderly, you name it. It's a mixture of those individuals. And a lot of those are younger kids, older people, and individuals who have comorbid conditions, who already have compromised immune systems and things like that. And so it protects others, especially like I just mentioned, the children, the older adults, and those with chronic conditions. And so if you know that you are prone to getting sick, some people just never get sick. Some people will catch a cold or whatever. So do what you need to do. And also by getting the flu shot, it helps to prevent and reduce the spread of the virus in the community. And so when we see kids going back to school, what do we see? An increase and an uptick in illnesses. And so we have to make sure that we're doing all the things that we can. Flu vaccinations reduce flu-related hospitalizations in adults by 40% and in children by 74%. 74% of children can be prevented, right, from going into the hospital just by themselves or someone else getting the flu shot. I want to tell you, frame it this way. I always tell my patients, getting the flu shot is like putting on your seatbelt. When we get in the car and we put our seatbelts on, we know that the seatbelt is not going to prevent an accident, but it can prevent it from being a severe or really bad accident. And that's the same with the flu shot. The flu shot may not prevent the flu, but it may prevent you from having serious complications if you were to come in contact and contract the flu. I can tell you there was me as a nurse. I was working on the floor, of course, as a nurse, and the hospital, the organization that I work with at the time, they would have our employee health come over and set up in a conference room and have the flu shots available for us. And I went to go get my flu shot, went down, got my flu shot, took my break, went and got me something to eat. I came back to the floor, and I tell you, within a couple of hours, I was having fever, chills. My nose was running like someone turned on the faucet. And I was like, gosh darn it, this flu shot done got me sick. I'm never getting this thing ever again. And it got so bad that my charge nurse ended up sending me home. And so I went home, and if my husband's watching, he can remember this because he got sick. The children got sick. Everybody in the house was sick. And so even as a healthcare provider, I just put two and two together. Listen, I was fine. Then I got this flu shot, and now I'm not fine. And so I had it in my mind that it was the flu shot that got me sick. That's not the case. Once I felt better, I got some Tamiflu, was off for about a week. I needed some rest, I guess, right? I don't know. But once I got back to work, I was able to talk with one of the infectious disease doctors, Dr. Sniffen. He and I had a rough start, but in the end, we were like two peas in a pod. And he had an epidemiologist that was rounding with him. And so I had an opportunity to sit down and pick their brain and talk to them. And I told him, listen, hey, what's up with this? I got the flu shot, and within a couple of hours, I was sick, like sick. And the likelihood of me getting the flu from the flu shot is 0%. 0.00000%. Why? Because it's not a live virus. It's an inactive virus. And there's no way for you to get sick from an inactive virus. Chances are I had, or someone in my family had come in contact with someone who was sick. And it just so happened it was almost like the perfect storm that my immune system was doing what the immune system does. And I had already come in contact with it. So, hey, full-fledged flu. And so I was able to get over that, but it took some time for me to reconcile that within my brain. And I think my husband was a little leery about getting the flu shot because, wait, now you were fine, you got the flu shot, you got sick, and then we all got sick. So he gets his flu shot, I get my flu shot, and we're doing our public duty by getting our flu shots to make sure that we're taking care of ourselves and everybody else. So who in your household gets their flu shot first? I think I am. I generally will get the vaccines first. So if you have not had your flu shot, this is a public service announcement. Go get your flu shot. They're free at the different pharmacies. Go get your flu shot. If you have not already done so, go and get your flu shot. All right. Enough of that. The next thing I want to talk about is asthma. And as I mentioned earlier, I can count on my fingers maybe 4 to 5 times over. So it's like 40 to 50 people that I know who have asthma. And sometimes people say, oh, I outgrew it, or, it's only triggered by certain things. And it's important for you to know what your triggers are, but it's also important for you to know the signs and symptoms of asthma. And some of the common symptoms of asthma is wheezing and chest tightness, as well as coughing at night. and shortness of breath, right? And then to know your triggers. Some people are triggered by different scents or perfumes. Some people are triggered by dust. Some people are triggered by pollen. Some people are triggered by animals. It just depends. Some people have exercise induced asthma. So it's important for you to know what your triggers are and to try to avoid those things at all cost possible, at all as possible, as much as possible, to avoid those things. Because if you constantly put yourself in a place where there's dogs and you know that that's a trigger for you, you're putting yourself at risk for having repeated asthma attacks, and that's not good overall. So when should someone get tested? Oh, I want to also mention this: cold air can sometimes trigger individuals asthma attack. And so when should you get checked? If your symptoms become so severe that they're interfering with your sleep, exercise, or your daily life, you need to get checked. And one thing I want to say is there are a lot of individuals who have asthma who don't have any treatment plans in place. And it's so important that you have a really stringent treatment plan in place, one that's going to work for you and one that will allow you to have the medications that you need on board when you need them. Some individuals will only have an inhaler that they'll take when they begin to have, experience symptoms. And they know typically they'll start wheezing or they'll have the tightness of the chest. And so they know then to start using their inhaler. And it's important to know how to use your inhaler. So if you are someone who has asthma or you have the flu or what have you, and you've been provided an inhaler, make sure you get the proper education on how to utilize it, because that's going to be key on how quick you're able to get that medication into your lungs and get your symptoms under control and resolved. And so the next thing I want to talk about is COPD. Chronic obstructive pulmonary disease is one of the common, as we mentioned, it's the fourth leading cause of death in the United States. And so we see increases in that because we have such a high number of individuals who smoke. And some of the signs and symptoms of that is a chronic cough, frequent lung infections. These individuals tend to have pneumonia and bronchitis frequently, and shortness of breath and also fatigue. If you think about it, if you can't breathe, you're not getting the oxygen, right, flowing through your body as that you need, and it's going to cause you to have that shortness of breath and several other symptoms. And so it's important to know your risk factors. It's important to understand what the symptoms are, and it's important to try to eliminate exposure to things that could potentially cause you to have COPD. One of the common things is smoking, secondhand smoke, and workplace exposure. I can remember seeing a patient, it was actually a couple, and the wife was pretty healthy. She didn't have any issues. She didn't take any prescription medication. She had a few supplements. She worked out all the time. She golfed a lot, and she was very active. Her husband, on the other hand, had a lot of respiratory issues. He continued to have respiratory infections. We couldn't figure out what was going on. We began working him up to see what was going on. And we were working him up for COPD because he was a smoker. He smoked a couple packs of cigarettes a day for many, many years. She began to have an infection, lung issues going on. We started working her up. Lo and behold, she tested, her results came back that she had lung cancer, like stage 3 lung cancer. Never smoked a day in her life, but her husband did. And individuals who smoke, typically they smoke filtered cigarettes. Majority of people do. And the filter helps them to some degree. However, when someone is exhaling that smoke, all of those things are coming out into the air, and the individuals who are around them are essentially smoking. I grew up in households where pretty much everybody smoked. Both my grandma smoked, my mom smoked. And so I joke and say I was smoking as a kid. Against my will, I was smoking. I love you, mama. But essentially, that's what I was doing. And I can recall having a colleague who was pregnant and was smoking. And she would get very defensive if you just kind of looked at her when she was smoking or what have you. My concern was for this baby. The baby doesn't have a choice. It didn't ask to be here and they're being introduced to smoke. And I'm not judgmental about it. To each his own. People do what they want to do. You're going to do what you want to do regardless. So I just want to make sure that I'm providing the education and the tools that you need to make sure that you're taking care of yourself. And if I can convince one person to stop smoking, then hey, I'm going to do it and I'm going to talk about it. So when should you get screened for COPD? So adults over the age of 40 with the smoking history should ask about spirometry, and that is and with this test they're checking the elasticity of your lungs. How well are you able to breathe in, to blow out, and to get air flowing through your lungs? And so if there's a diminish or decrease in that, then we start looking at, is this an obstructive lung disorder, pulmonary disorder such as COPD? One of the other things that I want to talk about tonight is allergies. And I will put out there's a difference between an allergy to a medication versus a side effect. So some people say, I can't take aspirin because it makes my stomach burn. That's not an allergy, that's a side effect. Some people will say, I can't eat tomatoes because I just don't like them. Well, it's not an allergy, it's a preference. And I have a friend, there's this running joke. Every time we get together, it's a couple. He'll say, don't put tomatoes on my stuff, I'm allergic. And his wife will say, you're not, it's just a preference. I digress. I'm gonna let them work that out. And they do every time. They do every time. But there's a difference between an allergy and a preference. And so I want you to know that there is a difference between an allergy and a side effect of a medication. So just be mindful of that. And when it comes to allergies, we know the signs for those who have, thank goodness I don't have seasonal allergies, but there are people who have seasonal allergies and it's really bad. Whenever the pollen is high, whenever the seasons are changing, they have the sneezing, the runny nose, the watery, itchy eyes, the congestion. Some even have rashes and hives that occur, and skin development. So it can be pretty bad, but there are things that we can do to help that. You want to make sure that if your symptoms are lasting longer than 2 weeks, that you're getting in seeing your healthcare provider. If you're taking over-counter medication and it's still not working, you want to get in and see your healthcare provider. If it's affecting your activity and your daily things that you normally do and you're not able to, you want to get in and see somebody. You want to get in, make sure there's nothing more than allergies, and see if there's something that can be done to help you. And typically individuals with allergies, they know what their triggers are, like pollen and grass and animals and certain foods and things of that nature. So if you know what your triggers are, then work to stay away from those things. But again, we can't get rid of pollen. You can't get away from pollen because we have trees. We live in Florida, or wherever you live, there's pollen during certain times, and in some seasons it's worse than others. So you just do what you need to do to protect yourself, and if you need help, ultimately reach out to your healthcare provider. What are some signs and symptoms of when you need to go see a healthcare provider with any of these things when it comes to any lung conditions or lung issues? Whether you're having shortness of breath and you're just sitting down and not doing much, coughing up blood is a big warning sign. Chest pain, wheezing that doesn't improve with medication or at rest, you need to seek medical care. You need to go and get seen immediately, because these could be signs of something worse or more dangerous or more serious, as I want to say. So it's important that we pay attention to our bodies. We need to know our bodies like the back of our hands. Right? We should know what's normal for us. So when something that's abnormal shows up, then we know, hey, something's not right. Something's not right. I can remember seeing a patient when I was a hospitalist at one of the local hospitals. I was a rounding NP there, and I worked with a hospitalist group. And this patient came in via the ER, and I admitted him. And he was in bad condition when he came in. He had been coughing up blood for months. He'd been dealing with shortness of breath and some other respiratory issues for a couple of years, and just thought, oh, it's nothing. He smoked like 3 to 4 packs of cigarettes a day. And unfortunately, when he came into us, he had a mass that was literally breaching the skin. And it was lung cancer that was literally coming through his skin. And treatment options were pretty limited at that point. And so we had to the team together and figure out what was going to be the best course of treatment for him. And it ended up being palliative care and hospice at this point for this gentleman. So I say all of that to say, don't delay getting treatment. Don't wait. If something is happening, if something is going on and it's out of the ordinary for you, don't delay getting help. Who here is watching or will watch on demand? If you have asthma, you have allergies, the seasonal colds, know what you can do or what you need to do. If you have asthma, you should have already talked to your primary care doctor, and many times you'll see a pulmonologist who can help you get on a treatment plan. Some individuals who have severe allergies will have one or multiple inhalers. They'll be on PO or oral medication that they take every single day. And it's important that we do everything that we can to prevent the asthma attacks, because every time you have an asthma attack, there's damage that's being caused to your lung tissue. And we want to make sure that we are preventing that. I've seen people die from asthma. They've had an asthma attack. They didn't have their medication on them, or medication didn't work in time, or they didn't take it. There's so many different variables there. So make sure that if you do have asthma, COPD, that you're staying on top of your symptoms and that you have your medication readily available for you. So one of the other things that we want to talk about, we talked about like allergies and the environment outdoors, but there are some things that we can do for our environment and keeping our air healthy at home, and things that we can do to prevent certain things. And so many of us live in homes that have ACs and have the HVAC. And so changing that filter every 3 months is important. If you can get a HEPA filter that filters and purifies the air, especially if you're someone that has asthma, make sure you, if you can, get one and put it in your room. Keeping the humidity between 30 and 50%. Air that is too humid or too dry can be a trigger for certain individuals who have allergies, who also have asthma and COPD. And then not smoking inside. And here's what I have to say about that. Individuals who smoke outside, great, thank you. However, those individuals come back inside, the smoke is still on their clothes. And so unless you're going to go and take a shower and, clean your clothes, then you're bringing the smoke in with you. It does decrease. Now, we'll say that. However, there's still that exposure to some degree to others. One thing I want to talk about while we're on the subject of smoking is vaping. The vape pens, the whatever you want to call it, the e-cigs, all of those. We have to be mindful because we don't know what's in those solutions that are in these vape pens or those e-cigs, and they're not FDA approved. And so we're seeing, and we have been seeing for a couple years now, maybe about 3 or 4 years now, maybe even longer, of something called popcorn lung in young individuals who were healthy before they started vaping. Vaping is just as addictive as drugs, just as addictive as crack. It's like, are people still using crack? I don't know. I don't know. Seriously, I don't know. And so it's just as addictive as heroin and many of the other drugs that people are utilizing now. So we have to be mindful, and we have to take time to educate our children, because a lot of these devices and companies are targeting and marketing them for our children. I was at a conference and they had a bunch of items laid out on the table, and we were tasked with finding the vape devices or the e-cigs. And it was so hard to find them because they looked like a pen was a vape pen. But we thought it was a regular pen. There was a cell phone. I'm gonna hold my cell phone up. There was a cell phone that had a case on it. It was very similar to mine. The case was the vape device, the phone case. So we have to be mindful of that. And just educate, talk to our kids. Again, it's been targeted towards them, and it's so addictive. I can remember there was a story on the news about a young kid, 17 years old, who got addicted to vaping and developed severe lung disease and was oxygen dependent. So we have to make sure that we're doing what we can do. So wearing a mask if the air quality is poor. There are certain areas where the air quality is poor. And, I can remember a couple years ago where there was fires in Canada and it came over into New York and individuals were walking around wearing masks. And then check the air quality index. You can do that on your phone. There's different apps that you can do that. And then make sure that we are staying inside if you're an individual who is sensitive to changes in the air. Stay inside. And I know that may be easy for me to say, but if you are someone who is sensitive and has to go outside and things in the air and in the environment can trigger you, you make sure you're wearing a mask, washing your hands, doing all the things. Okay, I want to make sure that I'm being sensitive to that and that I'm not being insensitive, because some of the things that I may say, I don't want it to come across as being rude, but I really want to be very blunt and upfront with you that there are things that you can do to um, prevent the triggers and from to prevent the asthma attacks from coming. So screening, when should we get screened? Flu shots, you should get a flu shot every year. Starting age 6 months and older, flu shot every year. Pneumonia vaccines are for individuals who are over the age of 65 or younger if they have a chronic condition. The COVID booster, if you're due, especially during the flu season. And then there's something that can be done as for individuals who smoke and who've had a history of smoking between the age of 50 and 80 and have a smoking history of 20 plus pack years of smoking. So it's recommended that you get a low dose CT or CAT scan of the lungs just as a baseline, because sometimes the chest x-rays may miss some of those small changes that can occur. The screenings are about catching the problem early. And I just wished that that gentleman that we saw that I admitted in the ER had come in so much earlier. We may have been able to change the outcome. We may have been able to prolong his life and prevent suffering. However, for whatever reason, he waited a long time to come in. When things are caught early, treatment is best. It works best when things are caught early. So don't wait for the symptoms to get worse. Seek help as soon as you can. Some of the frequent questions that I get is, can I get the flu shot? Or can the flu shot give me the flu? I already talked about that. No, it's inactive. So you can't get the flu from the flu shot. Now you may feel achiness or sore and things of that nature. That's just your body responding to the vaccination. Next question is, do healthy people need the flu shot? Yes. Just because you're healthy does not mean you can't spread it to other people. And so it's important that we all, if we can, and we meet criteria, are not allergic to any of the ingredients within the flu shot or the vaccination, that you get your flu shot. And if you are someone who is pro-vaccination, we have some people who are not, and they choose not to get any type of vaccination, and that's okay. It's everybody's, decision on what they're going to do with their bodies and their children. The last question is, what is the best exercise for healthy lungs? I can't hear you. You guys know I say this just about every time. Move your body is so important. 30 minutes of moderate intensity exercise, 5 days a week. So 150 minutes of moderate intensity exercise, walking, swimming, yoga, breathing exercises, things that are going to get your heart rate up and your respiration up, and it's going to help you do those deep breathing. There's also some deep breathing exercises that you can do. We talked about them. You can Google a few to see if they will work for you. It's important that we, one, stay up to date on what's going on and around in our communities. The flu is common, but it's preventable. So get your flu shot if you have not gotten it yet. Recognize the warning signs of COPD, asthma, and allergies if you are someone who is prone to those or you have those issues. Keep your air clean indoors and outdoors. So do what you can do within your home. The HEPA filters, changing the filters within your AC unit, and then strengthen your lungs with daily activities such as exercises, and then get screened. Get screened. Thank Thank you all so much for tuning in for another Wellness Wednesday with Dr. Latoya Wells. It's such a pleasure to show up and be here with you every Wednesday. Join me next Wednesday for another episode. We'll be in the month of November, so we'll have some different topics that we're going to talk about. If there's something that you would like to hear, or if you're an expert in any area that you'd like to join me for a session or two, let me know. I want to collaborate with some people. It's been a pleasure. I'm grateful to be back with you. Last week I was away at a conference. And so to be here tonight is amazing. And I'm looking forward to all that the month of November has to hold. Again, we are accepting new patients. We are also accepting several major insurances. So if you are in the market for a new healthcare provider, new primary care, someone that you want to partner with on your healthcare, someone who is going to provide individualized and personalized care, someone who's going to treat you like they would you if you were their own family. I'm it. I'm the person. I'm the provider. Reach out to us. Wells Legacy Health and Wellness. You can reach us at 321-306-6755. Share this information. We've gotten some new people that are coming to us, some new clients, new patients, just from word of mouth. I don't pay a lot of money for advertising and things of that nature. It's word of mouth is how I'm building this practice, one patient at a time. And my mission is to make sure that my friends, my family, and my community have the information that they need to advocate for themselves and to create a legacy of good health. That's what we do best at Wells Legacy Health and Wellness. Until next time, stay safe and be well. We'll talk to you soon. Bye.